Okay, so we're going to start with our congenital diseases. Am I pronouncing it right?
I think it's congenital, if I'm not wrong.
Okay. So I'm sure you're just going to follow the steps that we did last time. That one will read a case study. Then the next person will diagnose and then treat. Those are the stages, huh?
Perfect, yes.
So, JC, can you be the first one?
Sure, no problem. Okay, so a 3-year-old male native to central India presented with mild pallor and a history of on and off again abdominal and joint pains. On examination, the child had mild splenomegaly. He had a history of 2 prior hospital admissions. Sorry, I can read. The first one at 1 year old when he was diagnosed with pneumonia, and the second one at age 3 for fever, jaundice, and sorry, I can't see, chronic fatigue. He's had 3 blood transfusions. The last one was 3 months ago. And he has a history of sibling death at 5 years of age due to fever and jaundice.
Okay. The last part there, you say the blood transfusion and what?
He's had 3 blood transfusions. The last one was 3 months ago. And he has a history of sibling death at 5 years of age due to fever and jaundice.
Okay.
Who's student 2?
Who would you like to diagnose it?
I think maybe Stembile, you can diagnose, and I think Courtney, you can treat if you want to.
Sounds good to me.
Okay.
Okay. Trying to think what this could be. Is there any history of high temperatures or extreme temperatures?
Yes, his previous siblings have died from fever and jaundice, so yeah, high temperatures.
Could it be sickle cell anemia?
Yes.
Okay.
Well done.
Good. Looks like good job. So the treatment for that would be definitely a lot of hydration to try and flush out the fevers and everything, folate replacement, blood transfusion, and blood marrow transplant. The prognosis is quite variable depending on the degree of how severe it is. If he's had other siblings that have sounds like has died from this, then it's probably quite life-threatening. But if treated properly, he could live to middle age.
Okay. Oh, that was great. Thank you so much, Whitney and Jace. So we move on. Maybe I will read my case study. Then we'll ask some medicine to diagnose. Then Courtney, you treated last time, so
yeah,
Jace, you treat. Okay. So well, it's like a kid or a baby, he has a problem in that the nervous to foot weakness. That is, the mother brought the child saying that the child is weak and there is no bowel movement, and there is also the bladder dysfunctioning, and they are kind of partial paralysis. Well, so what could that be?
One second, my computer is let me try and load my document. Give me like 5 seconds. Okay, here we go. What were the symptoms again?
Nervous to foot weakness, no bowel movement, and bladder dysfunctioning, as well as partial paralysis.
Okay, thank you. Okay, does he have muscular dystrophy?
No, that's not the one.
Does he have cerebral palsy?
No.
Hydrocephalus?
Ah.
Dang. Oh, neural tube defects.
Yeah.
Okay.
That's the one.
Yeah, I think the partial paralysis is the giveaway with that one.
Okay.
So there's no cure, but you can get surgery to relieve some of the symptoms, and there are other supportive measures you can take. The prognosis depends on how severe it is, how severe the neurological deficit is, but it has a good prognosis.
Okay. Courtney.
Yeah. Will I do my case study?
Yes, you can read your case study. Then
Okay.
the
Who hasn't diagnosed yet?
yeah,
Me.
Jess. Okay.
Yeah, I'll type in.
Just to diagnose. And I haven't treated yet. I will treat.
So my case study, so there was an infant brought in that has hyperactive reflexes and muscle weaknesses. The child also has underdeveloped limbs. He had an infant neurological assessment and the child is unable to suck or keep food in their mouth, but they have use of their hands, not so much their legs, and changing diapers is a huge struggle for the mother.
Okay. How old is this child?
Like an infant, like
Oh, an infant. Okay.
18 months-ish.
Okay. Does he speak at all?
Not really.
Okay. Is it cerebral palsy or cerebral palsy?
Yeah. Good job.
Okay. Mhm. Okay. As for cerebral palsy, there is no cure, but there is a therapeutic treatment, which is which will help the child to function well, like the limbs, and also helping the intellectual disability, as well as speech therapy. Okay.
And I think also it also says that stem cells can be used as some sort of symptom reliever, which I think there's a lot of stem cell research going on. So maybe one day there will be a cure, but I think that's valuable to add to.
Okay. The use of stem cells.
Yes.
Okay. So, Madison, you haven't read your case study? Okay, so
Yeah,
it's
I
your
can read.
turn. You read your case study.
I can diagnose. I haven't diagnosed any yet.
Okay, then you can diagnose and he hasn't treated yet. Have you treated Madison? Oh, you can't treat
I
your
haven't
own
treated yet.
problem,
No, I can treat it. I can read it and treat
Oh,
it.
shame. Then you
No.
like doing your case study and treating.
You read it and then Courtney will diagnose, and maybe Jace or I myself will help to treat. Is that okay?
Yeah, and then shame, but then Madison doesn't also get a chance to treat.
So she
I
will
can.
do both.
I'll just find another case study maybe quickly, or
Okay.
I'll do another one and then Madison can treat.
All
Okay.
right. That's okay.
Okay. So there's this, it's an infant and they haven't had a bowel movement yet, and they've been born for 48 hours already. And their stomach is distended out. It's like puffed out. They have like a fever, they don't feel well, and they're just not doing like how a baby should. They're not thriving.
Okay. And the baby's 48 hours old, you said?
Yep.
And was there any signs of this during pregnancy? Does it say? Were they able to catch anything in an ultrasound? No.
I don't think so.
Has the child vomited at all?
No.
Is it the Hirschsprung disease, the
Yep.
congenital ganglionic megacolon?
Good job.
It's called the what?
Hirschsprung disease. It's like towards the end of the PowerPoint.
Okay. So the treatment that this is the surgical removal of the affected colon.
Yep.
They need to be reconnected to the normal bowel. Wait, so we can move on, and Jess, you can read your
Okay.
case study.
Okay, I've just thrown it together, so excuse me.
Okay.
So a male infant, he's 3 weeks old, has been vomiting. He won't latch, won't drink, he won't eat. He has a palpable mass in his epigastric region. And yeah. I think Stembele, would you like to diagnose, or Courtney, either one of you, and then Madison can treat.
Is it pyloric stensis?
Yes.
It's what pyloric stenosis.
Stenosis, yes.
Stenosis. Okay.
Okay. So diagnosis would be they need an X-ray, an ultrasound, lab test for dehydration and electrolyte imbalance, and it has to be surgically corrected. And if it goes well, it'll be successful.
Mm-hmm.
Brilliant.
Cool. I think that's everyone. Everyone's had a chance to do everything.
Yeah.
Yeah.
Cool.
Well, is that everything for the
Yeah, I think
Zoom?
so.
So we'll say that's all for this week.
Good luck with the rest of your studies, guys.
Yeah, thanks so much, guys, for participating.
Yeah, it was nice to see everyone again.
Yeah.
I see you guys.
See
Bye.
you next week. Bye.
Bye.